Well, when people get HIV and don't receive treatment, they will typically progress through 3 stages of the disease process. Stage 1, acute HIV infection. This happens within 2 to 4 weeks after infection with HIV. The patient may experience a flu-like illness which may last for a few weeks, and this is the body's natural response to the infection. When people have acute HIV infection, they have a large amount of virus in their blood and are very contagious. People with acute infection are often unaware that they are infected because they may not feel sick right away or even at all. To know whether someone has acute infection, either a 4th-generation antibody antigen test or a nucleic acid test is necessary. If you think you have been exposed to HIV through sex or drug use and you have flu-like symptoms, seek medical care and ask for a test to diagnose acute infection. Stage 2, the clinical latency or HIV inactivity or dormancy period. This period is sometimes called asymptomatic HIV infection or chronic HIV infection. During this phase, HIV is still active but reproduces at very low levels. People may not have any symptoms or even get sick during this time. For people who aren't taking medicine to treat HIV, this period can last about a decade or longer, but some may progress through this phase faster. People who are taking medicine to treat HIV the right way, every day, may be in this stage for several decades. Remember that people can still transmit HIV to others during this phase. Although people who are on ART and stay virally suppressed, which means having a very low level of virus in their blood, are much less likely to transmit HIV than those who are not virally suppressed. At the end of this phase, a person's viral load starts to go up and the CD4 cell count begins to go down. As this happens, the person may begin to have symptoms as the virus levels increase in the body and the person moves into stage 3. Stage 3, the acquired immunodeficiency syndrome. AIDS is the most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses called opportunistic illnesses. Without treatment, people with AIDS typically survive about 3 years. People are diagnosed with AIDS when their CD4 cell count drops below 200 cells per millimeter, or if they develop certain opportunistic illnesses. People with AIDS can have a high viral load and be very infectious. Common symptoms of AIDS include chills, fever, sweats, swollen lymph glands, weakness, and weight loss. Testing and diagnosis of HIV and AIDS. The only way to know for sure whether you have HIV is to get tested. The CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of a routine health care. Knowing your HIV status gives you powerful information to help you take steps to keep you and your partner healthy. If you test positive, you can take medicine to treat HIV to stay healthy for many years and greatly reduce the chance of transmitting HIV to your sex partner. If you test negative, you have more prevention tools available today to prevent HIV than ever before. If you're pregnant, you should be tested for HIV so that you can begin treatment if you're HIV positive. If an HIV positive woman is treated for HIV early in her pregnancy, the risk of transmitting HIV to her baby can be very low. There are 3 types of tests available. The first test is the nucleic acid test, or NAT. This is a very accurate test that looks for the actual virus in the blood. Usually it's considered accurate during the early stages of infection, but it's very expensive and not routinely used for screening individuals unless they recently had a high-risk exposure or a possible exposure and they have early symptoms of HIV infection. The second is an antigen antibody test. This looks for both HIV antibodies and antigens. It's also a rapid antigen antibody test which is now available. And then thirdly is just the antibody test. HIV tests are typically performed on blood or oral fluid, and they may also be performed on urine.